I'm Linda Rudolph. I work at the Center for Climate Change and Health, and I am going to breeze through a lot of material to give you an overview of a perspective on how climate change impacts health and how it's really closely related to issues around health inequities in our communities, and why those two issues are both the greatest challenges that we're confronting in health in the 21st century, and they can't really be separated. I think most of you have heard that the current thinking in public health is really that medical care only accounts for about 10% of what the health of a community looks like, and the rest comes from our living conditions, the physical, social, economic, and services environments in which people live, work, play, pray, learn, and when I was city health officer for Berkeley, we always added have sex. We know that those environments are not the same across different places, and that the things that are more likely to create health and the things that create ill health are inequitably distributed. So we have some neighborhoods with good food access, healthy transportation options, good jobs, good social relations, and others that have none of those things. And that's really why we have such stark health inequities both in the Bay Area and across the nation. So in Oakland, just as an example, because it's where we're sitting, if you're a child born in West Oakland, your life expectancy is about 71 years. If you're a white child born in the Oakland Hills, your life expectancy is about 85 years. That's repeated every place, and the differences are really found across educational attainment, across race, ethnicity, and poverty, most of all. So I'm going to switch gears and talk about climate change and health, and I'll come back to putting those two things together shortly. Again, I think everyone in this room understands that there's a whole variety of different things we do in terms of how we heat, cool, and light our homes, how we refrigerate our food, what we eat, how we get around, both in our cars and in our airplanes, how much we consume, and what we do with our land that leads to the emission of greenhouse gas emissions, and that those greenhouse gas emissions are having really significant impacts on our climate, most notably through warming, changes in snowpack, the melting of glaciers, the increase in extreme weather events, the acidification of the ocean, and sea level rise. Those global climate impacts have local impacts, such as coastal flooding or drought or specific extreme weather events or wildfires or extreme heat events. And those local climate impacts change the environment in ways such as changing the habitat for mosquitoes, or increasing the likelihood of food and water contamination, or decreasing crop yield, or increasing conflict over water and land. And it's those things that create the climate impacts of health. A recent very, very prestigious commission called the Lancet Commission on Health and Climate described those health impacts as being A, potentially catastrophic for human survival, undermining the last half century of gains in development and global health, and a medical emergency. So there's a lot of different climate health impacts. As Denise said, climate really is a multiplier for many of the health threats that we face. We're not going to go into any of them in detail, but I'll just run through them quickly. Extreme weather events are associated with injuries and long-standing impacts on health. Katrina caused 2,000 deaths, the displacement of 1.5 million people. Superstorm Sandy affected about 8 million people. Both events are associated with long-term diminishments of health in the people that suffered through those events, especially in mental health. We know that extreme weather events are increasing in frequency and severity as a result of climate change. Heat is the extreme weather event that causes the most deaths every year in the United States, but it also causes a whole variety of other health impacts. including increases in ozone and pollution levels, its association with wildfire dust, increases in polluting energy use, and so on. So I'll touch on some of these. In the Bay Area, we think that annual average temperatures are going to increase anywhere from about 3 degrees mid-century to as much as almost 11 degrees at the end of the century. Extreme heat events can kill a lot of people. People don't realize how severe they can be. The extreme heat wave in Europe in 2003 killed between 70 and 80,000 people. The Russian heat wave in 2010 killed between 11 and 55,000 people. California's heat wave in 2006 had about 650 excess deaths. People that live in urban areas are more at risk because urban heat islands can be up to 22 degrees hotter than the surrounding areas. Warming also increases the pollen season. Allergies affect around 50 million Americans. It's one of the leading causes of work absence and productivity losses. And the pollen season is now as long as a month longer in some parts of the U.S. because of climate change. I mentioned that warming also is associated with an increase in ozone levels, and that in turn is associated with a variety of adverse health outcomes, including asthma, heart disease, and other respiratory disease. And in the Bay Area, we already have a big problem with asthma. Several Bay Area locales, including parts of Oakland and parts of Emeryville, have among the highest rates of hospitalization for asthma in children around the country. And the California Air Resources Board has said basically that climate change may reduce the effectiveness of ozone emission reductions in San Francisco and the Bay Area sufficiently that it will completely overwhelm current emissions controls. Anyone who's been paying attention to news knows what climate change and the drought and heat are doing to wildfires. I just want to point out that wildfire smoke, which again is of particular concern for people with pre-existing respiratory and cardiovascular disease, can travel 1,000 miles. And if you've ever been up in Sacramento when there's an inversion layer and smoke hundreds of miles away in the Sierras, you know that it can be really, really severe bad air pollution. And the drought, worst drought in California's history, we know that drought is likely to increase in frequency and severity, but most importantly, it's exacerbated by warming and heat. Drought has its own whole set of health impacts, including impacts on water quality and availability, and wildfire, and it has a lot of mental health impacts. In a number of other nations, it's been associated with epidemics of suicide in farmers. Tulare County, that's about halfway between here and Los Angeles, is probably drought central right now. But just to give you a sense of what's going on there, there's around 6,000 or 7,000 people that literally don't have water coming out of their taps. So they are relying on bottled water and tanks being delivered to their house by the Tulare County Drought Task Force and its associated agencies to even have drinking water. I can tell you that none of these agencies thought when they started working for that county that they were going to be dealing with people in the state of California in the year 2015 literally not having access to water. But this is a harbinger of what's to come if we don't deal with climate change. The drought's also having a big impact on California agriculture. We've fallowed about 500,000 acres of croplands in California this year, and that leads to increased food prices, which in turn increase food insecurity, which is associated with higher risks for many chronic diseases, including diabetes and obesity. We have the worst harmful algal bloom that we've had off the coast of Washington, Oregon, and California, and that also impacts our food. It's associated with the warming of the ocean waters, but they've shut down shellfish harvesting, crab fishing in north of here, and the anchovy and sardine fisheries because of this harmful algal bloom. So there's many different routes to impacting our food supply. I'm not going to talk about vector-borne disease and impacts associated with heavy downpours. Again, there are multiple impacts Their sea level rise, the current estimates for the Bay Area are about up to 6 feet of sea level rise by 2100 if we stay on the current high emissions trajectory that we are on. And I think, you know, we know that the San Francisco and Oakland airports are likely to be underwater, as well as at least 100,000 homes in the Bay Area. We need to pay more attention, as the Pacific Institute looked at several years ago, to where are our healthcare facilities, our critical transportation infrastructure, our water treatment and wastewater treatment facilities, and our toxic hazardous waste. And if you map these, you'll see that they're all in areas of risk of flooding associated with sea level rise. So basically, I've walked through two pathways. I've walked through a pathway looking at how living conditions lead to adverse health outcomes and health inequities, and how greenhouse gas emissions lead to climate change, health outcomes. These are both taking place against the backdrop of other ecosystems collapse. So separate from climate change, we've got a serious problem with air pollution in California. We've got dead zones in the ocean from the over-application of nitrogen fertilizer in our agricultural system. We've got depletion of topsoil. We've got water contamination of groundwater basins all over the state and the nation. Again, much of it related to agriculture. And globally, we've got deforestation. These things are all interrelated. And they're interrelated because if you look at what really makes people the most susceptible to climate change, it's their living conditions and their pre-existing health status. That's also what makes people the most vulnerable to these other environmental impacts. And so what we see is that because of the differences in our neighborhoods and our communities, the same people that are at high risk for low life expectancy and chronic disease are at highest risk from the impacts of climate change. People that work outdoors that don't have good access to shade and drinking water, i.e. agricultural workers, are at really high risk of heat illness. The elderly and children are at risk of heat illness and impacts of ozone pollution. People that are poor and that don't have cars are at risk from not being able to evacuate during extreme weather events. And we saw this really clearly in Katrina and Sandy, where it was mainly poor and African American people who were left behind in really unlivable, dangerous situations. People that are living on the edge due to poverty can't afford increases in food prices that are associated with the declining crop yields that we're seeing from climate change. People that already have asthma or heart disease, or that already live in polluted areas near refineries or freeways, are most at risk from the increases in ozone and particulate matter that are associated with warming weather. So for all these reasons, and this is just an example of who is it that's getting asthma in Alameda County, we see that emergency department visits and hospitalizations are much higher in our African American population. That's just one example of how these things come together in terms of climate change being an exacerbating factor for health inequities. San Francisco's done the most work on this in the Bay Area. You can see it's areas around the Tenderloin and Chinatown where there's poverty, there's lots of pavement, there's no parks, there's no trees. These are the people that are most at risk. There's an older housing stock. These are the people that are most at risk from heat in the future. So we all know that we can make a choice about this. The difference in the future of climate change depends on choices that we make right now. This is heat with and without substantial mitigation efforts in climate change. Without mitigation, we risk climate change at levels that we will not be able to adapt to. Climate scientists now are talking about increases in heat that are so severe that they will exceed our physiological ability to adapt in terms of working outdoors, which will again exacerbate the impact on agriculture. Prevention provides protection. And that's why the Lancet Commission also concluded that tackling climate change could be the greatest global health opportunity of the 21st century for two reasons. One, we can avoid climate health impacts, and two, climate solutions have co-benefits. And if we pay careful attention to how we implement climate solutions, we can improve community health and reduce health inequities. A few examples. We know that if we build out a clean energy economy and put in place energy efficiency, we reduce greenhouse gases, we reduce air pollution, and we reduce fuel poverty. And we reduce asthma, respiratory disease, cardiovascular disease, and other adverse birth outcomes. These changes, for example, from putting in place regulations of carbon dioxide in emissions from power plants, will affect not just people that live near a power plant, but people all over the country, including those in California, because of the way winds blow from coal-powered power plants. The EPA estimates that the Clean Power Plan that's on the table now will significantly reduce premature deaths from heart attacks, reduce asthma attacks, and have health benefits of up to $34 billion by 2030. We know that there's a lot of health and well-being improvements from people that have energy retrofits in their house, reduce symptoms of respiratory and cardiovascular conditions, and improve mental health. We also know that if those weatherization and energy retrofits aren't done well, there can be unintended consequences, for example, from increasing exposure to lead or asbestos, or to mold, carbon monoxide, and radon, and other toxic materials in building materials. Active transportation, modest shifts from driving to walking, biking, and taking public transit have potentially the biggest public health gains. We could reduce cardiovascular disease deaths. This is from Southern California. I should have switched this out and shown you the same results for Northern California, but we could reduce cardiovascular disease deaths by about 12% with a very feasible shift to active transportation. That's bigger than the kinds of impacts we see from almost anything we do in public health. And I just will note that the benefits of active transportation actually significantly surpass the benefits of reducing air pollution. So we need to pay attention to all these different ways that we can mitigate greenhouse gas emissions. We still have to pay attention to equity. If you look at a map of who's getting rebates for clean electric and electric vehicles in California, it's not people in Richmond and West Oakland. It's not people in the Central Valley, because poor people, even with a rebate, are not able to buy $50,000 vehicles. So when we implement these carbon reducing policies, we really need to pay attention to who they're benefiting, and we need to make sure that our carbon reduction policies actually are benefiting the people that are the most harmed by climate change. So this is why climate change and social and health inequities go together and have to be addressed in concert with each other. We do have a choice. Anchor institutions have a really important role for a lot of reasons that I hope you'll all be talking about more. I think the most important role that you all have is that you have a voice. You have credibility in your communities, and you have credibility with policymakers. You can talk to people about why carbon solutions, climate solutions that address health and equity are so important. And I'm not seeing you at the table when I go to Sacramento and advocate for policies that are going to reduce the threat of climate change and improve health and equity in California. So I look forward to seeing you there in the future. Thanks. Thank you.